नमस्कार दोस्तों। फर्स्ट क्वेश्चन है रोटेशन साइट फॉर इंसुलिन इंजेक्शन should be separated from one another by 2.5 centimeter and should be used only. Option A every day, option B every other day, option C 1 to 2 weeks, option D 2 to 4 weeks. करेक्ट आंसर है 1 to 2 weeks। हमें एवरी वन एक से दो वीक के बाद उसकी साइट चेंज कर देनी चाहिए। का explanation है why. Rotation site for insulin injection should be separated from one another by 2.5 centimeter or 1 inch and should be used only every 1 to 2 weeks. Repeated use of the same site can cause lipodystrophy, a condition in which fat cells either shrink or expand abnormally. This can affect insulin absorption and lead to inconsistent blood glucose level. Next question. A patient is prescribed NPH insulin to be taken every morning. What is the most probable time for the patient to experience hypoglycemia? Option A 2 to 4 hours after administration, 6 to 14 hours after administration, 16 to 18 hours after administration, and 18 to 24 hours after administration. Correct answer है इसका 6 to 14 hours after administration. B. Why? Explain. The onset of hypoglycemia after NPH insulin administration is generally observed between 6 to 14 hours. This is because NPH insulin has an intermediate duration of action and its peak effect occurs 4 to 12 hours after administration. Therefore, the patient should be aware of the signs and symptoms of hypoglycemia during the time period. Next question. What is the correct way to administer eye drops to a patient? Option A. Place the drop directly on the cornea. B. Hold the drop above the eye and let the drop fall in. C. Place the drops on the conjunctiva just inside the lower eye. D. Place the drops on the white part of the eye sclera. Correct answer है इसका Place the drops on the conjunctiva just inside the lower eyelid. Explanation. The correct way to administer eye drops in to place the drops on the conjunctiva just inside the lower eyelid. This allows the medication to flow over the eye and be evenly distributed while minimizing the risk of the drops spilling out of the ear. Placing the drops directly on the cornea or on the white part of the eye can cause discomfort and irritation. Holding the dropper above the eye and letting the drops fall in may result in the drops missing the eye altogether. Question 4. What should you do before feeding a stroke patient? Position A. Position the patient sitting up in bed before you feed. B. Ask the patient about their medical history. Feed the patient quickly because there are three more waiting. D. Suction the patient's secretion before bite. Correct answer. Position the patient sitting up in bed before you feed. Explanation. Stroke patients are at risk of aspiration during feeding, which can lead to severe complications. Positioning the patient in a sitting position before feeding decreases the risk of aspiration. Ask the patient about their medical history is incorrect because it is not helpful for this case. Feed the patient quickly because there are three more waiting is incorrect because rushing the patient during feeding is not recommended. And suction the patient's secretions between bite of food is incorrect because suctioning between bites of food indicates that the patient is not handling secretion and it at risk of aspiration. The patient should be assessed further before feeding. Last question. A patient is most likely to experience feeling of rage during which stage of denial, anger, bargaining, and depression. Correct answer. Anger. फीलिंग ऑफ रेज है वो रेज यानी गुस्सा करेक्ट आंसर the anger stage of grief involve feelings of rage and resentment. The other choice do not reflect intense angry emotions. If you like this, thanks for watching. Like, share.